Pnawn da pawb a croeso. Good afternoon and welcome to our event today. Thank you to so many of you for being so prompt. We have received a lot of registrations for this event, so I am going to give it a minute or two. As you can see, people are still joining us, which is fantastic. And what I'll ask is if you could keep your microphones on mute, just to save some of that feedback. I could hear a little bit then. That's perfect. I can just hear myself now. So just watching as people still arrive. A few more seconds and I will make a start. Okay, well, thank you ever so much for joining us. I'm sure people will still continue to join. I know we've received a lot of registrations for this event. I'm going to do a quick introduction and just a little bit of housekeeping before I hand you over to Mason, who's going to be leading today's event. And for those of you who don't know me, I'm Dennis James and I'm the programme lead for the digital health ecosystem in Wales. And we're hosting today's event titled the NHS Wales API Platform. I'm not going to give too much away because I know Mason, Hugh, Barry and Martin have got lots of detail to tell you, and they're far more experienced and knowledgeable than I am, so I'm going to leave that to them. I can see a number of you have already done so, but can I just ask that you do mute yourself when we're in the group together, but do feel free to pop questions or just say hello, etc., and introduce yourself in the chat function. You'll probably notice we are recording today's event, so please do keep your cameras off. We have also received a number of questions beforehand, so we're going to do our best to ensure that we do cover these off during the presentation, and also we'll have a quick opportunity at the end to ask questions and take some questions there. So there's still some people joining us, but what I don't want to do is take up any more time because I think you're all here for the discussion and the presentation. So what I'll do now is just pass you over to Martin, to Mason, to introduce himself and lead us through the rest of the session. Thank you, Mason.
Hello everyone, hold on, I'm just struggling with my camera a second. There we are, you can all see me now and see me squirm as I try and explain to you what we've been doing. So as you know, this is about the NHS Wales API Platform. Just to sort of introduce the team here, I'm the, I suppose they're called senior product specialists in DHCW, but I suppose you might term this the product manager for the API platform. I've been putting this together with three of my main colleagues there, Barry, Martin and Hugh. I suppose Hugh has probably been leading this prior to me, so I'm kind of like picking up the baton where Hugh is sadly leaving us. If you've come to these sorts of sessions before, you may have seen Hugh or some of his colleagues presenting previously. So when I asked my project manager if he could do an introduction, he gave me a lovely little blurb to put up, and rather than say it, I thought it would be great to sort of quote it. I suppose the take home is that the journey's not over. There are miles to go before we sleep, but today's presentation will give the start of that journey, the identified next steps, and those colleagues who will be supporting the API management platform into service for NHS Wales. I think I need to point out that this is the API platform. So to a certain extent, you know, we're a small team. We're standing up this piece of technology. We have a limited amount of influence on the APIs that are prioritized for publication on the platform, and therefore, you know, it's limited how much you know, how much we can prioritize things as a project. but no doubt we have our preferences in terms of who we want to sort of look after first. We've come to a little bit more of that later, I think. So maybe some of you might be new here, so you might be wondering, you know, these particular questions, and obviously these are the things that we're going to be covering. And how far have we got with building our platform? That's really what you want to know. But as a bit of an icebreaker, we'd like to run an audience poll. So hopefully this will work. If you'd all like to use your phones and just log on to menti.com, I've got a couple of questions to ask. And it might be nice to get a feel for the audience and the things we might want to speak to in this presentation. Okay, so that's a good representative sample. I think there's 62 of you in the meeting. So yeah, so most of you know what an API is. We'll not cover that in too much depth, I suppose, but we have got those slides that people can have a look at in a second. So I'll move us on to the next question then. How do I do that? Next question. There we are. Next slide. So is that one working for everybody?
Yep.
Oh yeah, there we are. It's coming through. Okay, so we got some nice, I like that Lego. I saw fire in there. Obviously we got the obvious ones, integration, standards, interoperability, data security, all good stuff. Ease of use. Yeah. Okay, thank you. Yeah. I should try and keep hold of this somehow. I don't know whether I can save. I probably save the data somewhere. But thanks very much. I'll leave that one open, and you can carry on contributing if you like. So what we'll talk about now is I'll hand over to for some of you who may not be familiar with who we are. I'll hand over to one of my colleagues, Hugh, to take us through this. Sorry, Hugh, I've realised I've brought you in too early, haven't I?
Yeah,
I've brought you in
Happy
too
to talk
early.
through it if you want.
Yeah, go on. You go ahead. I've disturbed your piece now. You might as well continue.
Sure. Yeah, I've done this blurb before. So I think probably most people in the session are aware of what NHS Wales is, but just a quick overview if you're not. So it is pretty separate from NHS England, Scotland, and Northern Ireland. It's its own thing. It's a fairly straightforward structure, I think. It's not one single organization, it's a collection of different organizations. So the main component is the of the different regional health boards, who all have their demarcated sort of area of responsibility based on geography. What you then have, the things listed down on the right hand side here, are some sort of NHS trusts and special health authorities that generally have a national remit for certain things. So for instance, there's in Velindre, you've got the Cancer Centre and Blood Service, that sort of national things. Sorry, phone going in the background. And you've got Digital Health and Care Wales, which has a national remit for digital services. Yeah, so that's just a bit of context. What is NHS Wales?
So this one, yeah, so this one, the NDR thing, I was going to see if Martin was going to cover this, but I'm not sure he's been able to connect yet.
No, I have, but I am here, Mason, if you want me to very quickly.
Yeah, are you all right to cover this, the slides about the NDR, Martin?
Yeah, very quickly. Yeah, I can do. So obviously the NDR is a programme. It's delivering against objectives set out in Healthier Wales, and obviously pivotal to the success of the NDR will be data and how we use data, how we utilise data, how we make that data available. And to support that, there are 9 strategic objectives which are on the screen now, and they run from everything from the timely responsible access to data all the way through to collaboration. And obviously the one thing which is obviously fairly synergist with now is consistent communication. So this is us communicating about API. So we're ticking that box. NDR is still fairly young in its life, but I think it's starting to make some waves. So yeah, we're part of the NDR. We're running this project called API. There's also things like the data platform, and we're supported by the full range of activities from DHCW, from communications, commercial, finance, etc., as you would imagine. In a nutshell, that's us.
So governance structure, I suppose the NDR board reports and provides updates to stakeholder engagement group and the NDR management board. Obviously it's funded by Welsh government, so they have to keep them happy. We've got some external assurance and key relationships there on the left hand side that I suppose the API management project has had to be cognizant of. In terms of where we sit in here, we've got a little board sort of underneath the NDR delivery group. So just again, sort of emphasizing that we are a significant project, but we're quite small in terms of our resource, and obviously we rely on the wider program to give us that reach in terms of some of the prioritization that we need to sort of engage with. This again is a nice slide based on the All Wales data platform concept. I think what's nice is that there's a little sort of light grey semicircle at the bottom here where it says data integration and APIs. So we're firmly in that space in terms of what we're delivering as part of our technology. There we are. So Hugh, this really is you this time.
Okay, thanks, Mason. As it seemed from the poll that most people know what an API is, I won't spend too long on this, but in a word, it's just a way for computer programs to talk to each other. So you have a defined interface for communication. So there's a few examples there. The top one where you've got an app running on your desktop, say Microsoft Word, and you want to print that document, so you click the print button in the Microsoft Word app. What that does then is send a call through to a Windows API that says, Windows, I need to print, and Windows will go, okay, let me see who handles print jobs, and send the details off to the printer to get it magically printed for you. So some similar thing happens with if you take a mobile app, but in this case, that communication might actually be going across the internet to a server. So if you've got the Facebook mobile app and you update your profile, say that I now don't like cats anymore, it's going to send a message across the internet to Facebook's servers, normally using HTTP protocols, but at the API layer. And then, yeah, magically updates your profile. So obviously we have a need to do to move data around in NHS Wales, and APIs are a key mechanism for doing that. So we'll have examples where we've got a healthcare app, perhaps running on a desktop system in a hospital. It needs to update patients' details or get information about a particular organisation. So that's the example we've got there. It will look up the organisation code, pull the details and the address. So a bit more detail about what APIs NHS Wales have. This is a extremely abridged version of the architecture, and really just the Digital Health and Care Wales sort of slice of responsibility of it. So across the top layer there, you can see a selection of different sort of information systems and applications that we have that have actual human end users, shown in blue at the top. Now, in the background, when those systems need to get data or store data and make it shareable with other systems, their main way to do that is to log it into one of these national services shown in the grey bar down the bottom. So those national services essentially are a shared repository of data. So if someone's in the Welsh Clinical Portal and they stored information about a patient, that can go and fetch information from, say, the Welsh Results and Report Service that has been stored there from a laboratory information system. The same way that Choose Pharmacy, used by pharmacists, can go and grab information about a patient record. So all these colourful lines you see are sort of flows of information and requests for information. These circular dots in the yellow messaging components bar, those are supposed to represent the APIs. So you've got there, say, an API for the Welsh Care Record Service over on the left, which has sort of clinical documents. So if there's a discharge advice letter from when you're discharged from hospital, that will get stored in the Welsh Care Record Service through the API call, and then various flows will make it available then to Choose Pharmacy to be able to go and retrieve it again with the API and take a look at that document, so the pharmacist knows, okay, you've been discharged, you're supposed to be prescribed these medicines, let me dispense them. Yeah, so that's a little bit of a flavour. As I said, some caveats that this is very abridged version and doesn't represent a lot of the things that other NHS Wales organisations like health boards and other NHS trusts. They also have apps and systems that sort of plug into this architecture and also do their own things outside of this sort of core national architecture if there's local systems that are purely local. But that's a bit of a flavour of what APIs there are and how we're using them.
Thanks, Hugh. I'll move us on because we have got a lot of slides to get through. So why are we building an API platform? So a lot of the responses were, obviously, we were asking about APIs, but what's an API platform? So this was something that I like to sort of consider in terms of what opportunities an API platform gives us. So I've got some providers of API there in that sort of reddy pink color, and some consumers So some providers of APIs and some consumers using apps down the bottom. So without API management, you've got various challenges around routing, connecting apps, security. So all of those challenges need to be undertaken on a case-by-case basis. There's no central monitoring control, and it's difficult to maintain that consistency in terms of what that sort of connection to an API needs to look like. Whereas with API management on the right-hand side, because we're going through that centrally controlled sort of point there, it makes things simplified in terms of connections. There's less connections. Security and operations and monitoring can obviously be standardized. Lots of opportunities for code, procedure and policy reuse. You've got your central control and monitoring, and it's easier to establish the consistency across APIs. So another way of putting it is, I'm an API producer. I'm developing an API that I want lots of apps to use. It would be quick, but to control access, I have to implement a way to register those apps and authenticate them. And so your little Windows helper says, publish your API through an API platform. It provides an app registry and built-in app authentication, which you can use to secure your API. So on the other hand, API consumer, I'm developing an app that connects to several APIs. It would be quick, but I've been issued a separate set of credentials for each one, and they all authenticate differently. So again, little helper says all of those APIs are published through the API platform. Then API producers can share the same app registration, and you can use a common set of credentials. So that's something to maybe consider. So yes, just to emphasize the point, API producers to implement security controls and manage access to APIs, and API consumers to request and access and manage their access keys. What API management also allows us to do in this instance as well is it allows NHS Wales APIs to be accessed over the internet. What we've not seen in the previous diagram is a lot of that stuff is already hosted in the NHS Wales network, and therefore we're sort of limited on some of the services and apps that we can plug into, because they've got to be sort of hosted or reachable from that network. And moving forward, this gives us the opportunity to potentially plug into sort of services and apps that are hosted on the internet. So there we are. So the meat of the presentation, now project work to date. So this is a timeline of activity, because I know that perhaps a couple of you have been to some of these previous presentations, and you know, it's kind of like, yeah, we've been talking about this for a while. I suppose these things do take a while to get traction and to be delivered to sort of operational standards fit for sort of obviously looking after patient data. So in April 2021, we obviously got the green light on the strategy, and then July we had the procurement strategy approved. October of last year we completed the procurement. We actually started delivery then right at the end of the year, start of January this year, and by April we had a sort of vanilla install complete. Difficulty is that you know, Apigee straight out of the box is kind of like, or the product that we chose in our procurement straight out the box is sort of best configured for internet hosted APIs. a lot of our APIs are still based on our network, so we had to then sort of integrate that within our network and make those connections, and indeed the creation of an NHS Wales domain joining with the Google domain there. So August of this year, we managed to get the platform and the design approved and completed. As we have also, there's a little bit of a complexity here, because as we have also now, by virtue of the fact invested in Apigee, we've invested in the Google product. There is a wider project then within the NDR looking to sort of leverage Google technology. You know, they made their separate assessment. Again, Google technology came out the best as far as some of the wider health requirements were concerned. So those supporting Google components do need to be aligned with the wider NDR program moving forward. We're now at the point where we will be publishing some dev endpoints because it's a little bit sort of, you know, still very much alpha at the moment and could break very easily. We're making that available to selected partners so they can help, you know, make sure that it's going to be robust and going to stand up for sort of a wider audience of people to select. So I think we got 4 APIs that we're hoping to make available at the end of the month, or certainly very, very shortly into the beginning of next month. January, we're working on some security and versioning standards that need to be agreed through various boards. April, we are hoping to deliver a next tranche of dev APIs. Unfortunately, because we have an issue with sort of, and I think that this is a problem with maybe it's a problem with IT companies across Wales. The cupboard is bare when you go to recruit. The team has had 4 near misses in terms of being able to recruit additional people into the team. We need that team fully resourced before we can go live with production APIs. So that's our main sort of sticking point and challenge at the moment. But as you can see, we have got penciled in an updated developer portal to be launched and integrated with the National Intelligence Audit System. And again, sort of thinking about how we publish APIs and get consumers onto the service, we're wanting to build that sort of autonomy as much as possible into it, so that we're not the bottleneck with regard to sort of the wider publication and consumption of APIs through the platform. So this is a little bit on the design. So the platform supports 5 environments. So you've got a dev environment. So this is where people will, your API people will perhaps work with new features of their APIs, or sort of, you know, be rolling out sort of patches or anything like that. So that will connect to development versions of APIs. Then you've got SIP, which is a bit more robust than dev. We'll be able to obviously allow data to be pushed in through one API and maybe pulled out of another API to sort of get testing done that way. Sandbox. The idea with Sandbox is, again, like development and SIT, it has synthetic data, but we'll probably want that to be from an API design point of view to mimic as much of live as possible, so that people can get their head around production. And then we move to UAT and production. So those systems are in terms of the way that they're managed within the platform. They'll be on a sort of separate domain, but effectively that's where some of your sensitive data is. So just going round, obviously standardized security and functionality for people as they or apps as they access these APIs. For consumers, the developer portal, and for publishers, we're obviously thinking about a standard set of tools to help those guys as well. The other thing to point out, authentication and monitoring to be, integrated with key NHS systems. So we've got the NHS NADEX, possibly at a future date, the DSPP login that we're looking at as well. Okay. So standards development. So I suppose it's difficult to know. Again, we're responsible for an API proxy platform. There will be some standards that we'll ask of API teams before they can publish on our platform. So they must have a dev environment, for instance, as a minimum. So that would be a standard that we would ask of API publishers. Similarly with API consumers. Now there are some other standards and best practices for APIs themselves that will probably say, well, this isn't maybe a standard as such. This is something that you might like to think about when you develop and make your API available. So there's a couple of places where we are referencing and getting some influence from, and we're working. We've got connections with our equivalents in NHS England. I think who are a little bit further ahead of us with regard to their sort of API management story. I think it's sometimes as we're looking through these things, we look at a particular requirement, either for an API or a connecting application. Is it a standard that we're looking at? Is it best practice? Is it a piece of advice? It's a good idea to do that. You should do that. Or is it something that is incorporated within our standard operations? And I think we're sort of working through a list of ideas with respect to that at the moment. The types of areas that we're thinking with APIs are around consumer design, security standards, publication and access, and for operating practices as well, as you can read there. One of the points that I'll make at this stage is that we see we've got underlying API standards like FHIR, being adopted more widely at the moment. We're not necessarily going to be too worried about the sort of data standards. We're more about the connecting standards and maybe some of the monitoring and operational standards, if you get the distinction, in terms of how that would work. So there we are. I'll hand over to Barry now, who's going to give us a little chat about some of our approach to security.
Thanks, Mason. Yeah, so this is a diagram. As it says, this is our kind of layered security model, and just wanted to talk for a few minutes just about the kind of security that we've got in place. I think in this slide and the next slide, that there's two of our slices of it. So this is kind of a high-level picture, and the sort of red arrows coming in from the left there, and the blue arrows going into the center. So that is basically your API coming into the center of our network, retrieving data, and going back out again. And at the moment, most, not all, most of our data is in data centers on premise. We have one of our endpoints is actually going to be already on the internet. But this is kind of a picture of what the API is going to pass through. So just going around in this kind of, someone called it the onion diagram from the outside in. We've got HTTPS, which is your standard transport, layer security, 1.2. So that's encryption is in place. So any API that wants to come in is got to get through that. And then we've got our WAF, which is a web application firewall, which is Google provided firewall that we can set a number of rules so we can block things that we don't want to come in. So for example, it's common to do what's called Geo Ip Blocking. So we know that all our consumers, our consumers that want to use our APIs are all in certain countries. So we can just by rote say we're not accepting any API calls from a whole suite of countries. So we can just on our web application firewall, we can just block things to that level. So if any calls come in from a country that we're not interested in, it'll just immediately reject them. What we've also got in the WAF is we've got security benchmarks based around the OWASP top 10 threats. So OWASP is an organization that keeps track of the top 10 kind of threats for web security, and they publish benchmarks, and Google gives us a way to create policies on our web firewall to just basically block out things like cross-site scripting attacks or injection attacks and a number of things. So we kind of, you've got to pass, any API coming in is going to pass through all of these kind of filters. Now then, when you get into sort of the second white line, from the outside in, we've kind of got our platform kind of authentication and authorization at that level. I think we're going to talk a little bit more about that on the next slide. So this is the idea that if you're going to talk to us and you're going to send data to us, we're going to want you to provide something to us so we know who you are, so we can authenticate you, and then we can see that you actually can access data that you're allowed to access. And sort of pretty standard API security. Two arrows going out on the right here. One is to a SIEM, and that's a system information and event management system. And this is the fact that we export a whole lot of logs, basically constantly. There's a constant flow of logs of changes to our platform going out to a system that monitors it and provides alerts if there's anything spurious going on. We've also got the Google Command Center that checks for misconfiguration, which is kind of that's where you sort of create a security vulnerability by accident. You sort of misconfigure something. So we've got something monitoring that constantly all the time. And then so once you come past that sort of platform authorization level, which I said I'll talk about in the next slide, you're into our perimeter network control. So there's actually another layer of firewalls in front of our back end, and then of course you're in and you're retrieving your data. So of course we actually want people to use our data, but we obviously want the right people and people that are authorized and people that are allowed in. So this is just representing some of the security that we've got in place. As I said, there's layers, so you've got to get past every layer in order to come in and get your data. So if Mason can just move it on to the next slide. Thanks, Mason. So in terms of if you take a single API that's going to be dispatched to an endpoint on Apigee that we've got working, there's based on the data, the level of data sensitivity that requires kind of being returned. In the backend system, we've got a number of levels of security. You can see they're from level 0 to level 4, which basically represent, it's representing us looking at the data and saying, well, is this public data? If it's public data, we want to do something so we can track the traffic, but we don't need to secure it, in sort of the complete lock and key, because it might be public already. And that typically is level 1 security. So we would provide people that are coming in and accessing our data with something called an API key, which is something they would have to put in their API, so it identifies them and it comes in. That's typically data that's public. That's not considered super secure. So what we'll be implementing is level 1 and then level 4 security, which is, I'm jumping right to the top, which is using something called an access token. So that's this is probably one of the most secure ways of accessing APIs. We're using something called an RSA public and private key. So we're signing, the client signs something with a secure key that only he has access to, and he passes that in, and only someone with the key on the other, the specific public key on the other side, can actually verify that it was signed by the consumer. So we have a secure way of making sure that it was you and only you that sent that request to us, and then we know who you are and we know what you're allowed to access, so we can check these things on both ends. So this is a classic way of kind of securing API traffic. Of course, this is happening in addition to the things in the layer of the onion, you know, through encryption and through our web application firewall. There's also, I didn't mention that there's also a set of IP restrictions in place as well, so we can limit the location that the IP addresses are coming from. And as I said, I suppose the security we ask you to put in place if you're going to come and use our platform will be dependent on the kind of data you're accessing and how sensitive the data is, and what the security requirements are for that data at the time. Yeah, that's pretty much it. I think is it back to you now, Mason?
Yeah, thanks, Barry. That's great. So I've got this just a couple more slides left. So this is another standard that we've been working on, the API versioning standard. So the connecting security standard was one previous. This is the API versioning standard. So the idea is that we need to be able to support major changes to APIs, so breaking changes to APIs. So this is an example of a URI that we would use. The API name or the API identifier would fit in that URI. V1, so this would be version 1 of that particular API. And in this case, you've got the subdomain dev. That's actually one of the 5 environments that I was talking about earlier. So, you know, that would be dev, sit, sandbox, UAT, and prod. So that's how you would get to a particular API. The point that I'm saying here is that V1 or V2 or VX would always be present and supports, as I say, that pre-release of a version change if needed, and allows 2 or more backends APIs to be published in parallel. So we're saying that if you go from version 1 to version 2 as a consuming app, you'll need time to make the changes that you need to migrate to the new version of the API, and this is how our proxy would handle that. Another point to make here, and you know, this is something that we need to think about very soon, is the NHS Wales catalog entry or the developer portal. Each API and each version will be supported by some documentation, and that would be conforming to the Open API specification or WSDL, depending on the technology. Again, going back to our standards, is that a must? Is that a should? We don't know yet, but we're obviously thinking that it makes it much easier if all of our APIs are sort of documented using the same standard. So future work. So we've got to think about now the operational management of the platform. Now that we're putting things on there, there's some changes that Google are asking us to make, and we'll make things a little bit simpler in terms of the implementation. Something called Private Service Connect. We'll be taking care of that. We'll need to do some operational acceptance tests, because I suppose from next month, this is the first time that we would have gone all the way through the API proxy to a backend API, and we need to sort of check that's working exactly as we've expected. We need to do some failover tests. We've got site redundancy, but we've also got failover to a site in Brussels as well, and we need to check to make sure that that's going, because we will be serving critical healthcare data and supporting critical healthcare data APIs on this platform. So we need to absolutely make sure that it's 24/7 availability. So there's some work that we need to do that Martin and I need to do on the project management side, thinking a little bit more about our next governance hurdles that we've got to overcome. And maybe we need to think about how we prioritize API publishers and consumers. Ultimately, that's being driven for us to a large extent by the wider NDR program, but as a project, we want to try and maybe think about how we can take some of the emotion out of that, so that we can maybe objectively prioritize some of the we've got lots of interest, lots of people who want to get access to APIs. So how can we objectively prioritize which customers we deal with first? So yeah, thinking about our API providers and API consumers, how-to guide. We need to think about how we support API teams. The idea is that we want to give as much ownership and control of the proxy code to the API teams, so that they can, as I said before, they can obviously make changes or make alterations to their proxy when making changes to their underlying API. So there's a little bit of business change. Yeah, okay, thank you, Hamish. Need rather than want. Okay. So there's a little bit of business change and training we need to do for our API teams. We need to get them up to speed. We need to get them confident with using the platform. And then on the consumer side, we need to obviously maybe run some more events like this to make sure that you guys are fully informed with what we're doing here, and so that you can get involved. Yeah, developer portal relaunch. Some of you have been perhaps at other meetings will know that we sort of a couple of years ago set up a developer portal with some sandbox APIs in. Again, sort of that really did prove the need that something more substantial was needed. So we're going to be working on scoping that moving forward. A little bit in terms of on authentication using that NetX ID that we spoke about earlier, and as I mentioned earlier, again, integration with Nhs. Right, okay, so we've got about 12 minutes.
Thank you, Mason. Shall I just zip back through some of the comments on the meeting chat, and just let's make sure that we've covered off some of those questions, because I know you've been answering as you go along, but let's just make sure that we cover them off. I know Angela started off just asking about when the platform will be in place, what APIs will be delivered in what order. And I know you have mentioned that in some of your slides, but I suppose really following on from that as well, there's a question there about, as well as the API roadmap being developed, how will you prioritize what APIs go on there? And I can see there was a question further down, or a comment from Phil, just about demographics API being something that we desperately need, and I just wonder how those priorities are going to be determined.
So certainly if you've got a requirement for a particular API, then please let us know. What we are doing at the moment, in the absence of any sort of, because as I say, lots of people need APIs and need to publish their data. So we are sort of struggling with demand a little bit, I suppose, in terms of where we should prioritize. But by all means, speak to us, because it's good to get those use cases and get as much information as we can about what the roadmap could look like. And then we can then go back to our board, even at this stage, and say, look, you know, these are the types of requests that are coming through. You know, that I've spoken to a lot of different programs and project managers already, and where we can clearly see that there's common themes coming, clearly that gives us an idea of which APIs then to prioritize, if that helps, Delith.
Thank you. And Angela, she's just come back to say, can she just represent her question on what gets delivered and when, just because there's a little bit of uncertainty there. And just to clarify, we will share these slides, because I know you did have a bit of a time frame within the slides earlier, but if you just want to respond to that, just in terms of the information you have at hand at the moment.
Yeah, I wish I could answer that with more detail. It was Angela, was it? I wish I could answer that with more detail, Angela. You know, we're under-resourced. It's a very new project for us. We are feeling our way as we go with some of this. Put it this way, I would hope within a year's time to be able to give you a proper catalogue of APIs that are available, and let you know exactly how to connect and consume stuff. But how that's going to unfold over the next 12 months, we really don't know yet. Sorry
to jump in. It's Angela, Director of Digital Transformation at Cardiff and Vale. And thanks, Mason. That was a really honest answer. And we're all having problems like you in terms of recruitment, for example. This is something that we've all been waiting for you know, quite a long time, since the architectural review was published, and I know you'll appreciate that. But I wonder, how can the whole system work together to support the delivery of this platform and those APIs upon which we are all absolutely dependent? And the longer it goes on, the more it's killing us. And that's not a criticism. I think that's just a statement of fact. So, you know, what can we do together? How can we help? And certainly with the prioritization piece, you know, that has to be done, I think, out in the open with all of us.
Yeah, absolutely, Angela. Well, like I say, just, you know, so that we get your name on the list, by all means, speak to us. I've got a big, long spreadsheet, but you know, that is really important to me, to build up that pipeline. Again, you know, that's going to influence how we look at things and prioritize things. And you're absolutely right. We need to do that out in the open. We need to let people know exactly where the requests are coming from, where the pressures are in terms of sort of API publication. Yes. But
so
yes,
I think that's what I'm advocating.
The invitation is there, Angela. Please feel free to reach out to myself or Mark Frame.
I'm reaching out. Put me on the list.
Okay.
There's a few other people that will want to be on that list. But I think it would be really helpful, perhaps, if interested parties representing the UHBs and yourselves did get in a room and have a conversation.
Yeah.
Thank you.
I think that's a really practical example of what we could do to do that. And so maybe if we have a conversation offline, Mason and the team, about how we could facilitate some of that, maybe, and make sure that that's taken forward. I think there's been a lot of really interesting discussion on the chat throughout the presentation. And I don't know if Hamish wants to come in. I'm not sure that some of the sort of points and questions sit within your team, Mason, and I know Hamish has made some really good points there around the discussion, especially about the NDR being well funded and a high value investment, and would it not have been better to invest in moving the APIs rather than delaying the deployment? So I don't know, Hamish, is there anything that you want to add to that? And just to sort of, while we've got Mason and the team online, I'm not sure that Mason, it's your place to answer some of those points, but if there's anything there that Hamish you want to add.
Thanks, Delith, and thanks, Mason and colleagues, for a helpful overview. And I would just echo Angela's point and emphasize the fact that I suspect that many of the programs and portfolios and projects that need APIs probably need the same APIs. and actually you could make a lot of people happy by developing a relatively small number of APIs, and you would address quite a lot of the need. Because it is a need, it isn't a want. People aren't asking for an API just because they fancy having an API. They're asking it because they've invested a substantial amount of money in a product that requires an API to work. Yeah, I mean, the question, it doesn't really matter, does it, now, because you've done it, but it does strike me odd that rather than move the APIs to the cloud, which is where your Apigee was supposed to run, you spent a lot of time moving Apigee to on-premise, creating a lot of complexity and delay.
Yeah,
and it isn't because of money, is it? You had shed loads of money.
Yeah. So just reading your question there, Hamish, you said, would it not have been better to invest in moving the APIs than delaying the deployment of Apigee? So what my response on that would be, the Apigee product itself is probably quite agile when you compare it to the infrastructure of some of these APIs. Moving some of these APIs, so I'm sort of in the team that are responsible. So I work with national operational databases, the team that looks after the integration services, you know, the Fiorano platform. So, you know, they're quite complicated technologies. Yeah, and the demographics service as well. So if you're interested in those three, that they're probably going, because they're very close, they are probably the ones that are likely to be prioritized. But I don't want to preempt anything. But
which are the ones Mason are coming next month or this month? Which are those four?
So those four are terminology, MPI, so that's PICS and PDQ. There's I always forget so I'm going to ask one of my team to help me out with the other two.
WRRS and WCRS.
Thank you.
And they're going to be production APIs, are they?
No. As I say, we can't move ourselves into production until we've got a team that can support a 24/7 service.
And do you think that if we, just for a minute, but assume money is not the problem, do you think it would be possible to buy in a team of people, not to work for DHCW, but to work independently at no doubt at greater cost, into your team to get these APIs done faster?
Well, Hamish, I could probably agree with you privately, but in this public forum, it's a question. I'm not asking if you should do it. I'm asking if we could do it. Do you think we could do it? We could, of course. You know, you could speed things up, and you could maybe, you know, buy some resource in as contractors or even a little service. I've done that sort of thing in a past life. It's not a decision that's available to me, I don't think, at the moment. Maybe I can take that away and put that to the board, Hamish.
I wasn't even necessarily saying you need to resource it. Would you welcome it if it could be done?
I think I would.
Personally,
Martin,
do you want to come in on this?
Yeah, just it's kind of, Mason doesn't know about this because we only agreed it 10 minutes before the meeting. There is a emerging suggestion to that effect being discussed, without promise, without prejudice, commitment, obviously, but that is a realistic option to discuss moving forward, Hamish. So yeah, I think if we can get these meetings in the diaries I put in the chat, I think that's certainly something we can pick up and review and see the practicalities, really. But as I say, without prejudice, commitment, that is an emerging picture within the NDR at the minute, as of this afternoon. So it's fairly new news.
Thank you, Martin. Hamish, good idea. I would be, as sort of, you know, product owner, I would be supportive of that. Absolutely.
Fantastic. It's been a good meeting then.
I'm just really conscious that we're coming to the end of the time, and I just want to reassure people who haven't had their questions responded to in the chat and via email prior to this event, that we will include some more comment in the sort of follow-up and thank you email that we'll send out to you all with a copy of the recording for this event. So we'll try and make sure those are answered. I think there was a really good outcome from the discussion, just in terms of having a commitment to holding meetings to help prioritise those APIs. And as you can see in the chat, Martin, as he just mentioned, you know, to please email him or Mason so that we can start to move that forward. And us within the ecosystem, you know, we're happy to help facilitate that as we go ahead. So I just want to say thank you very much to Mason, Hugh, Barry and Martin for providing us with that update, because I think, you know, given the amount of people that registered to come along, there's a huge amount of interest in this area. And I also liked Mason's comment during the presentation just about having regular updates, and I'm sure lots of people would appreciate that as well. So thank you ever so much for everybody for attending. That was a really informative hour, and I don't know where those 60 minutes have gone, so thank you so much. And Hamish has just added some more to the chat there. Oh no,
it's a reply.
Hugh. It's Hugh. It's a reply. Yes, sorry, I didn't see that. Thank you, Hugh. So
Yeah,
I
just...
go on, quick.
Don't worry, Hugh. I'll read it. I'll read it and take your word for it. I was basing it on what you said earlier. That's all.
Yeah, no worries.
Okay.
Fabulous. Thank you, everyone.